Okay, so let's look at this model for communication strategies. This is about where we ended up. So here you have, we talked about formal instruction and how gave some examples of formal instruction. And formal instruction in this area is, mildly successful. These two things here, guided learning and real world practice, are often more beneficial. And then once they, you help guide them in that learning, they practice it, they bring it back here they come back here with issues, they bring that back to the formal instruction, and that helps guide future formal instructions related to communication strategies. So it's kind of an interwoven process. And again, we talked about formal instructions where the participants learn various types of communication strategies and other listening and speaking behaviors are exposed to in examples. The group leader can facilitate and provide suggestions that aren't brought up by the group members. Here's some examples, or here's an example that we talked about in class. Guided learning, we talked about watching videotape scenarios of those situations. You can even record and do some quasi real life scenarios. Again, I think I mentioned in class, we had a individual who was probably late 30s, early 40s in the CI group when I was at my previous university, and was going out on an interview. We had somebody from career service come, we videotaped it, and we watched it later to facilitate and help guide that person. Modeling is also an important component of guided learning. We do that with graduate students in clinic all the time. We model different behaviors, different types of interactions with patients and parents, siblings of patients, family members, and so forth. In real world practice, again, that's the best you can do. Go out there, practice them. Keep a diary, a hearing diary, they call it, to kind of monitor what works, what doesn't work, and so forth. We tell people who wear hearing aids to all the time keep not necessarily a diary, but keep track of situations where they perform well and where they don't. So that way that can inform our programming of the hearing aid, adjusting the hearing aid, and so forth. Short-term training, they make little tutorials that are out there. I've never used them. They have computer-based programs that help people with various techniques and strategies. I am not super familiar with them because I haven't used them. But at Texas Tech, we had the students make a tutorial for our CI, group, or for our oral rehab group, which consisted of hearing aid users and also cochlear implant users. So in the text, it talks about this watch tutorial, and it goes through what all of those mean. This sometimes is extremely important, where you have to change a situation and try to modify that. It could be moving to a different part of the room where the noise level is less substantial, that sort of thing. Now, as we talked about in class, involving frequent communication partners, such as spouses or friends or significant others, adult children of individuals, or parents in general who have younger children with hearing loss. Everybody benefits from this kind of training. May help them understand a bit more about what's going on, how the person's feeling, and understand how difficult it is to speech read or lip read. Encourage behaviors that will reduce communication breakdowns. As I mentioned, lots of people they who don't have hearing loss talk to patients, talk to family members, frequent communication partners from different rooms. Obviously, that's not ideal. Hearing aids and cochlear implants are not designed to pick up speech from 3 rooms away. That's just not how they work. So the training is very important. And then also sometimes the family members need some support and counseling about how they have to adjust their lifestyle to effectively communicate with somebody with hearing loss. So here's some aspects of frequent communication partner training. We've talked about in the past clear speech, right? If you slow down about 10% and you speak about 10% louder, that's my own example, people will understand more and it will reduce communication issues. Speak facing. Don't cover your mouth and don't talk from another room. Those are very, very important components of communication partner training. You can have them try lip reading and see how they do, and they'll quickly realize that it's difficult. They should speak in kind of organized messages without a lot of extra words. Often checking for comprehension. Okay, so confirming with the listener that what's being said is understood. And then understanding effective repairs, right? Instead of repeating over and over again, you rephrase and use some facial, so those nonverbal cues, facial expressions, that should be ION, facial expressions and hand gestures. So like anything else with oral rehab, it's messy. It's a messy research area because there are so many other variables that are very difficult to control, right? But at the end of the day, I think we can sum it up like we've talked about auditory training research and that even if it's really hard to draw this cause-effect relationship between these items and the hearing-related disability, most people will report that it does reduce the perception of their hearing-related disability. Now, when we talked about self-efficacy, reducing the perception is important, but that doesn't mean that performance is better. Okay, but here's some information about research: good patient participation or compliance. Benefits shown if that's the case. If they use those communication strategies, a reduction in the perceived hearing-related disability. That's the important point. Reduced rate of hearing aid returns, and then reported benefit by frequent communication partners just makes the situation easier. This reduced rate of hearing aid returns is important from like a audiology business perspective. You can't run a practice when people bring hearing aids, but they bring your products back all the time. And so it's also not good for the patients, right? They need them. They should be wearing them. And so financially, it's important. Patient care perspective, it's important. The more services, there is research to show the more services, the more you give to patients, the more you provide to patients, the less likely they are to return their hearing aids. They feel vested, okay? So I highlighted this because this is always the case. Some people will be super motivated. Some people will absolutely not want to do it. This is important. Meta communication skills, thinking about communication. There's a lot of planning and higher order thinking kind of that needs to go into this. You know your limitations, right? We teach college and I'm teaching my middle school kids this about, your limitations when you're studying, right? This may distract you. So then fix that, deal with that effectively. And so same goes for Patients with hearing loss, wearing hearing aids, they know situations. And so I always tell patients, if you don't hear well in background noise, right? Your hearing aids don't work great in background noise. When you go to a restaurant, think ahead. Look when you're entering the restaurant and ask the hostess if you can have a seat away from noise, right? That's just a simple request. Now, it might not be possible depending on the restaurant, but if possible, sit away from the extraneous noise. Maybe they have a quiet room that they're starting to open up and let people go in and so forth. So that's thinking about the communication issues you have. Okay. That's it for Chapter 8.